Hey class, Bethany Beasley. I'm going to be doing the transcranial Doppler exam on my son here. So first we're going to flip this around, and your patient needs to be laying supine. You're going to be behind the patient's head for this exam. I have my little pretend transducer here, just my makeup stick. I couldn't really find anything else. So there are 3 windows that we're going to be using today: the transorbital, transtemporal, and the foramen magnum. So we're going to talk about each one of those windows, the vessels that we can see in those windows. So to start off the exam, we're going to have the patient laying flat. We're going to have them close their eyes, and then transducer is going to go just in the center of the eyelid while the eye is closed. This is the transorbital window. We can see the ophthalmic and the carotid siphon in these windows. The ophthalmic is the first branch off the ICA, and it feeds oxygenated blood to the vessels inside of the eye's orbit, as well as muscles in the face and part of the nose. And the siphon does the same thing. It feeds different portions of the face with oxygenated blood. The next window is the transtemporal window. So that will be on the temporal aspect of the head, right here, kind of above where the ear is. I don't know if you can see where I am. Thank you, James. All right. So you can see the 3 vessels in this one. They are the medial, anterior, and posterior cerebral arteries. The medial is the largest of the 3. All 3 of them supply oxygenated blood to different lobes of the brain. This one would be the medial window, the anterior window, and the posterior window. So just slight movements, almost like in a triangle shape for each one of those. The next window, you're going to have your patient turn their head off to the side. Move your arm, honey. Turn their head off to the side. They would probably need to slip the pillow out from underneath them. The next window is the foramen magnum, and this will be at the base of the skull on the back of the head here. So the vessels that you can see in this window here will be the vertebrals, like what we see when we're doing carotid exams, and we pan posterior to see those. So the vertebrals will be seen in the basilar arteries, if I said that right. So the vertebrals feed the spinal cord and the brainstem, and then this posterior portion of the brain here. And the basilar arteries come off of the vertebral arteries and then join back right here at the base of the skull and also feed the brain with oxygenated blood. So those are all 3 of the windows. Indicators for this exam would be to do a determination for if a patient is brain dead. It can be used if there's a possible vasospasm, or if there's a clot, or if the patient had a stroke and they're having problems with their eyes and vision and things like that. All of those can be indications for doing this exam. Thanks. Have a great day.